were saying grinding. You the noise. So you grind. So you grind at night. Okay. During the day too.
As far as I know.
Okay.
I hope not.
Grind at night. And noise in the ear. Noise. The left.
Every drop of sunshine.
Okay. So noise.
Every
I
drop
feel
of
like the
rain.
grinding has been for so long that
Every time the wind blows, I hear your name. Every time a flower grows,
Tell about your eyes. Anything?
or a baby cries.
Yeah. Anyway, so
Everything that's young and
this
old
time, we'll also be treating next time.
lives and
Next
dies.
time.
Oh, that's the one that
Yeah,
the
sorry.
side
I don't know what's out there
But I'm going out of town next week.
way behind the sun.
Yeah.
And I've got a feeling that we're not the only one. I can see miracles happening all the time. And I can see eternity through infinite eyes.
Oh, it's your phone?
I think Tracy breaker. Okay, so what kind of work are you doing?
I was just a thing
What do you think? Oh, baby, what caused this to
just the other
caused
day.
this to activate out of the right and left?
About some other universe, not so far away.
Grinding?
Maybe I'm
I'm
an
not sure, but I
alien
feel like since the right side is the
from a neighborhood star. Maybe I'll just fly away on a slide guitar.
yeah, there's
And I don't know what's out there way behind
feels like
the
the
sun.
You should get like 20 chairs there, sit 20 people get
Now
one
I've got
shot,
a
like,
feeling
I'll wait for you.
that we're not the only one.
And animals too.
And I can see miracles happening all the time. And I can see eternity through infinite eyes.
This song's about the eyes today. It's Brandy Carlos.
It really breaks my
Oh
heart
yeah, I like this girl.
to see a dear old friend go down to the worn out place again. Do you know the sound
You listen to Midnight Special?
of a closing door?
Yeah.
Have you heard that sound somewhere before?
The right words because these are the wrong ones.
Do you wonder if she knows you anymore? Or wrapped your love around me like a chain? But I never was afraid that it would die.
Yeah.
Crazy.
You can dance in a hurricane,
Because they didn't have a goodbye.
but only if you're standing in the eye.
It sounds exactly like a perfect old-fashioned sign-off.
Where did you learn to walk? Where did you learn to run away from everything you love?
We're supposed to applaud at different moments.
Did you think the bottle would ever ease your pain? Did you think that love's a foolish game?
We have special effects where you see energy.
Did you find someone else to take the blame?
How many pairs of glasses can you wear at one time, Sharon?
Wrapped your love around me like a chain, but I never was afraid that it would die. You can dance in a hurricane,
Some of all the
Yeah.
trigger point pain patterns on the head and neck pain.
only if you're standing in the eye. You can dance in a hurricane,
Two cameras can jump back and forth.
but only if you're standing in the
You
eye.
have two periscopes running at the same time, right?
Well, when you're talking to the muscle, you can flash right to the picture. And right back to
What?
where you're working.
Oh, I see.
You know what I mean?
Yeah.
This is the la.
I am a sturdy soul,
You only have 3 bags, right?
and there ain't no shame in lying down in the bed you made.
Broadcast, you'll see it either. That's why
Can you
she's
fight the
out.
urge to run for another day?
No offense to your next
You might make it further if you learn to stay. I wrapped your love around me like a chain, but I never was afraid that it would die. You can dance in a hurricane, but only if you're standing in the eye. You can dance in a hurricane, but only if you're standing in the eye.
Oh, that's a good
Every drop of sunshine, every drop of rain, and every time the wind blows, I hear
So if the
your
camera's
name.
on you, just make sure you're doing what.
Every time a flower
So
grows,
something else.
You mean when camera's gonna
or a baby
Well,
cries,
let's make sure it's not the.
everything that's young and old
I'm not doing anything when you're doing your thing.
Well,
lives.
I'm just saying, if you, I just was in case because it would be distracting if I were doing one thing that if you're.
I don't know what's out
Very
there,
good.
way behind the sun. And I've got a feeling that we're
No,
not
it's good. I like it. I like it.
You should have a whole corner of people doing self-care.
I can see miracles happening all the time,
looking up.
and I can see eternity through infinite eyes.
It looks good if you're in the bathroom. You can't miss it. It's a nice view.
Here?
I was just a thinking, just the other day, about some other universe, not so far away. Well, maybe I'm an alien from a neighborhood star, or maybe I'll just fly away on a slide guitar. And I don't know what's out there, way behind the sun. And I've got a feeling
Did you move your
that we're
tables
not
yet?
the only one.
Like, so it needed to be moved the other day, so this will be good.
And I can see miracles happening all the time. And I can see eternity through
Well,
infinite
that was good.
eyes.
I could look at it, yeah, it'd be good. You can start filling out. What were you saying, son?
What's the new place like?
Stupid.
It's too big?
Stupid.
Stupid?
Way too small.
Still be the one that you're in now, the church.
Who knows?
You know, Norman's in the hospital too.
Really?
Yeah, he fell at a gas station and bruised himself and went to the hospital. And
No.
got an infection.
Really? No.
This is Jeff Mose, Looking Skies.
You should have like live guitar while you're doing it.
Right.
It really breaks my heart to see a dear old friend go down to the worn out place again. Do you know the sound of a closing door? Have you heard that sound somewhere before? Do you wonder if she knows you anymore? Or wrapped your love around me like a chain, but I never was afraid that it would die.
So my plan is to have a musician's corner
You can dance in a hurricane,
at the same day as today.
but
maybe
only if you're standing in the eye.
And then musicians will come to play, and then we'll find their repetitive overuses that will treat them.
Where did you learn to walk?
It'll be great. And then
Where did you learn to run
I might do like
away from everything you love?
Or
Pia.
yeah,
At noon.
Did you think the bottle would ever ease your pain? Did you think that love's a foolish game?
Every day I'll go to different kind of.
Did you find someone else to take the blame?
And then treat them and pick the
Or wrapped your love around me like a chain,
like the guy with the white hair, the person.
but I never was afraid that it would die.
Yeah, okay. Yeah.
Yeah, this will be like that.
You can dance in a hurricane,
Everybody's business, and we'll take pictures.
but only if you're standing in the eye.
Country will know that
You can dance in a hurricane,
because they're so real. That's such a great
but
environment.
only if you're standing in the
Yeah, and musician
eye.
websites
Right.
and all that too.
So I'm working on those ideas for coming up. As soon as we get this one down really good.
Yeah. Because I'll have to message with Justin to put it on all the different schools to have them have a link to this too, since AMTA was being
I am a
Illinois
sturdy
Chapter was
soul,
being better.
You should have like the.
and there ain't no shame
You should have different set of muscles.
in lying down in the bed you made.
Different musicians will come in each.
Can you fight the urge to run for another day?
Unless they want.
You might make it further.
I'll tell
If
my,
you learn
my
to
music
stay.
teacher. I just saw yesterday. I'm gonna see her Saturday. We're going out for
I wrapped your love around me like a chain,
I'll tell her.
Okay, so
but I never was afraid that it would die.
we need a tool.
More tools.
You can dance in a hurricane,
There's some tools.
but only if you're standing in the eye. You can dance in a hurricane,
This is called a shockwave.
but only if you're standing in the eye.
Oh, okay, I'll sit still.
What nationality is that?
Polish. Originally it's Greek.
I never heard of any Polish thing that.
You heard of Xena, the element?
No.
58?
I've heard of Zenith, the TV.
I've heard of
Xena
58.
lights? Huh?
No.
58.
Yeah.
Every drop of
No, I don't think
sunshine,
so.
every drop of rain, every time the wind blows,
Isn't there another? There's another.
I hear your name.
Zenek.
Is that it?
Yeah.
Every
What's the
time a
name in
flower grows,
I mean strange.
or a baby cries,
Like xenophobia, fear of strangers.
everything that's
okay.
young and
I'm
old.
not afraid of strangers. So
Yeah.
I've never heard of that.
Well,
I'm a little afraid of you.
That word.
Yeah, yeah, I think you're
really
really
better be.
I
we have our eyes on you for a while. This is a test. We're grading you.
Now I've got a feeling
No, I'm not afraid of anything.
that we're not the only one. I can see miracles happening all
Broadcasting.
the time,
So they got the good music and then they got
and I can
you
see
talking in the background.
Oh, is it broadcasting already?
It's already
Yes.
broadcasting. Everything you guys have been saying, it's all
Oh.
coming through.
Yeah, you watch
They should look up the ESF documentary. Everybody should look at that.
I was just a thinking, just the other day, about some other universe, not so far away.
You're perfect.
Maybe I'm an
Oh my
alien
gosh, you're writing my soul notes out? That's
from a
great.
neighborhood
great?
star.
Self-correction is off. Don't self-correct yourself.
Maybe I'll just fly
As far
away
as you're concerned, you never
on a
make
slide guitar.
anything contrary to that is a misinterpretation. Try it.
And I don't know what's out there, way behind the sun.
I'll sit and I'll just say, I'm not going to
Now I've
correct
got a
anything for the rest of my
feeling
entire life.
that we're not
Goes,
the only one.
We can say that's
And I
your
can see
reference
miracles
process.
yes.
happening all the time,
Yeah. Yes, yeah.
and I can see eternity through implanted eyes.
We just run in front of them. But this is, so I just need these right here, okay? And this is the up down, this is okay, so this would be good. This would be
Anybody got cell phones in here?
so we,
Should everybody mute their cell phones if they're in there? Anybody got it?
No, I don't have that. Did you ever have a fake buzzing on your thigh thinking it's the vibration on the phone?
I have.
You know, everybody I know is talking about that.
Yeah, it's so useful.
Looking skies.
okay, so I need some music for the exercise part, so how should we do that? Are we can we use this for the music? We could use,
Yeah.
okay, we could, okay,
Would these songs work?
yeah,
Okay. We'll use these songs.
right.
It really breaks my heart to see a dear old friend go down to the worn out place again.
The Lords or?
Do you know the sound of a closing door? Have you heard that sound somewhere before? Do you wonder if she knows you anymore?
Change it this time.
Or wrapped your love around me like a chain, but I never was afraid that it would die. You can dance in a hurricane, but only if you're standing in the eye. Where did you learn to walk? Where did you learn to run? Away from everything you love. Did you think the bottle would ever ease your pain? Did you think that love was
Look at all these people with back numbers.
Is it alright?
to take the blame?
Is it alright if you get home?
Wrapped your love around me like a chain,
Is it okay if you film us?
but I never was afraid that it would die.
Unless our audience has seen the photo.
You can dance in a hurricane, but only if you're standing in the
Ask everybody watching
eye.
if it's okay if we're filming.
You can dance in a hurricane, but only if you're standing in the eye.
6'3". 6'3". Some people stand up when they're too small. Yeah, frightening looking. Look, when you this big. I got in that on an elevator.
I am a sturdy soul,
There's nobody under 6.
and there ain't no shame in lying down in the bed you made.
Tall guy never feels short.
Can you fight the urge to run for another day? You might make it further if you learn to stay. I wrapped your love around me like a chain,
They will soon.
but I never was afraid that it would die. You can dance in a
Vitamin
hurricane,
C. It wouldn't hurt to do magnesium.
but only if you're standing in the
Vitamin C is
eye.
really big if people have this slight tendency towards
You can dance in a hurricane,
or a big tendency.
Well, yeah, but Norman's got a
only if you're standing in the eye.
I've used it. I never felt it worked. But I like the idea of it working.
Well, it's good to cleanse your liver.
Yeah, but hopefully it works.
Every drop of sunshine,
Oh, it's close.
every
It's
drop,
almost time.
every time the wind
Oh, it
blows,
starts in 2 minutes.
I hear your name. Every time a flower grows, or a baby cries,
But with this visual.
everything that's young and old
This is young.
lives and dies. I don't know what's out there
No, it isn't.
way behind
Maybe
the
it does.
sun.
I'm hoping it does. I'm hoping it.
Now I've got a feeling that we're not the only one.
Probably take that off.
I can see miracles happening all the time,
Did you ever in the trial
and I
takes
can
place?
see
Did you ever see?
through his blinded eyes.
Is it the first part? Yeah, put it somewhere else.
I was just a thinking, just the other day, about some other universe, not so far away. Or maybe I'm an alien from a neighborhood star. Or maybe I'll just fly away on a slide
I don't
guitar.
know if you want to-
the sun. And I've got a feeling that we're not the only one. And I can see miracles happening all the time. And I can see eternity through imprinted eyes.
All right, here we go. Welcome, Bodyworkers, to the eye and eyebrow pain class.
The National Self-Care Alliance Masters Program.
Absolutely.
Oh, you better unplug that there. Good.
All right, we're live.
We're live. Hi.
Here's the Bodyworker Mastercourse teacher,
Hi there.
Sharon Sauer. Thank you very much for teaching every time. This is great. Thank you so much for teaching in spite of your injury last week. Yeah. Oh.
Okay.
Great. What are you going to teach us today?
We're going to learn how to eliminate eye pain and eyebrow pain and eye dysfunction caused by muscle dysfunction.
Mm-hmm.
So, or referred pain to that part of the body. So muscle dysfunction and referred pain to the eye. So it'll be really great. Well, this is going to be helping with people with every kind of headache, especially the headaches that go from the back of the kind of migraine headache that has that pain from the back of the eye to the front, and twitching, and then excessive eye watering. Those are all things we're going to be working on today.
Blurry vision too.
Oh, blurred vision, I meant to say. Oh,
yeah,
thank you.
Great.
Thanks for
Excellent.
saying that. Yeah. Blurred vision is real important.
Like from living a very myopic life where we never stare at anything beyond 5 feet from us.
That's it.
Yeah.
Then our eyes get like really sucked down small and smaller and smaller. But now we're going to get them to be more expansive.
More sunsets, people. We need more sunsets, more lake views.
That's it.
Plus good self-care.
So today we're going to do Protocol 5, which is everything that refers pain into the eye. And next week we're going to do Protocol 6.
Ooh, I love 6.
Ooh, what's great about 6?
What is great about 6?
Well, 6 is if we're going to eliminate ear pain and dysfunction, but also we're going to get rid of
ear pain and dysfunction?
Oh, but a lot of people have ear infections.
Oh, ear infections.
So invite all your friends to come to watch. Every parent, everybody who wants to learn how to eliminate ear infections and ear pain, and next time. And so that's coming up next time. So make sure to be at that one. That's Protocol 6.
Can't I just poke holes in my eardrum and drain fluid that way? I mean, and take a bunch of antibiotics? Would that be better?
No. This would be better.
Oh, okay. Yeah. All right. So let's get 100 to 200 people next week, because every mom in the world should know how to do this.
Yes. So I've got some schools where all the moms in the school have been teaching all the other moms, and everybody in the school and all the kids know how to eliminate ear pain and dysfunction.
Excellent.
So they're all doing well with that. So today we're doing eye pain though, and a lot of the same ones that cause eye pain also cause ear pain. So we'll get those both this time and next
beautiful.
time. So
may I show them the pain key?
Oh, would you?
Okay.
So we're going to look at all the materials that we're going to use today.
5.
So this is number 5, and you can see that the muscle on the top is the most likely one to cause the pain. And which one is that?
Sternocleidomastoid.
Sternocleidomastoid. Then the second most likely one is the temporalis. The third most likely one is the masseter, the splenius cervicis. The next one is the masseter, then the suboccipitals, then the occipitalis, then the orbicularis oculi, then the trapezius, then the infra and suprahyoids, then the longus coli and the longus capitis. Now, I should rename all the muscles so that they're easier to understand for those of you. So I'll try to rename them as we're going along to make it a little easier to understand.
All right, so everybody should have, hopefully you've downloaded and printed out this pain key chart, because this is it. This is the formula. This
explains it all.
This is Sharon's 30+ years of experience put into a single double-sided chart.
The Rosetta Stone of myofascial pain.
Yeah, that's it. And it's free, and it's 11 by 17. You can print it anywhere for pennies. All right.
Right, and Dr. Simons worked with me on this, and we worked on it together, and he said this would be so good. He says doctors find it so difficult to figure out myofascial pain dysfunction, and he felt this would be the ideal thing for them to have on their wall. It would help them to figure out which muscles are causing the person's pain and dysfunction.
Yeah. And then with every single one of these numbers comes a protocol. So now it just so happens that some of the ones in the eye and ear and head region are still the original hand drawn. How long ago might you have drawn some of these, Sharon?
Yeah, I did draw them a long time ago. I started drawing them maybe in 1988.
Okay,
Yeah, so these were some drawings that I made back then. But most of the protocols I've redone,
Yeah.
and didn't.
Yeah,
But this
yeah.
particular one, I think we might have redone them, but I don't know where I put it. Maybe. But anyway, this is protocol 5. This is many of the muscles that refer into the eye. So here you see the sternocleidomastoid. You'll see the temporalis, the masseter. We're taking a look at the superinfrahyoids, the splenius cervicis here, trapezius, and the longus colli and capitis, and the muscles around the eye.
And here's a tool that every healthcare practitioner needs. It's a yellow highlighter, or any color, but what you do is you know this sheet of paper doesn't mean anything to anyone when they look at it.
But you got to write on it.
But once you write on it, it means everything.
So the first muscle, the most likely one to cause eye pain
Yeah.
and nauseousness and eye dysfunction is the sternocleidomastoid, and that's the first one.
So circle that if your patients have it. So you should be printing these out. And you can download them all and store them on your hard drive and just print out the ones that the patients need, and then whip out your fancy highlighter, and then you personalize it, and they take it home, and it means a lot to them. And then their husbands look at it and they think, I'm going to come in 8 years from now, when
That's
it's
right.
really bad and I can't move. But then the wife makes them an appointment next week.
So I make little notes
Yeah.
and say how to treat it and stuff.
Yeah.
And then that helps people to know what to
Yeah,
do.
yeah. And then there's there's some range of motion tests on some of these. These ones, here's spray and stretch. That's right. In fact, we're doing spray and stretch today. Oh,
Yes, we're gonna
see,
do a
and
little
there's a
spray and
can of
stretch.
one.
That's a can right there.
Yeah, so that's one of the unique things we're going to do today. Some spray and
So
stretch.
we're going to use heat and cold.
Okay.
So that's always important to use the heat along with the cold, so you don't want to over chill it. The
Excellent.
person.
All right. What are we using as our source of heat?
So today we have these great heat sources. So today we're going to use the Thermocore, and this is a great. The reason I like this one is, like, say for instance we're doing spraying an area, then these are really hot, and so you could go ahead and spray the area. It's cold, and you get it right on the area and warm it right back up really fast. So it works really great. And then I like to do it while we're stretching it. So if we have the splenius surfaces, we're going to turn your head and then tip your chin down, or the levator, and you're going to turn and really spray it while you're stretching it. Or the trapezius. Yeah.
Excellent. And then just heat it up right
And then
afterwards.
we heat it up right after. Yeah.
Nice. Oh, great.
And you can put the little heat on them while you're doing it, so they don't get cold while you're spraying with the cold spray.
Excellent. So we'll have that. It looks like we've got a big pinky ball.
Yeah, well, we
And,
often use that for the.
We've got our Travell and Simons book, of
Yes,
course.
here we got our Travell and Simon. So everyone, it'd be great to get these books, and you can get those on Amazon.
Sure.
And it'd be great to order these posters from Amazon. These are to the Travell and Simon Trigger Point Pain Pattern posters, and they're around a little more than $100 for a set of those.
Okay.
And then these are great to get. You need to be able to pass all these range of motion tests. But today, the tests we're going to be doing are here: 1, 2, 3, 4. We're going to be doing 8 and 9, and also 15. So these are the ones we're going to be doing today. But if you want to have a pain-free, full function, all your joints working life, you want to pass all these range of motion tests every day.
Yeah.
And so you can pick these up from Carol Shiflett, and you can get that from Round Earth Publishing. So, and we have a few that we could send out. We've got a couple of them, so if anyone would like any, we could send them to them.
This is a great thing to do, by the way, when you've got people with insomnia or restless legs or something. Just, they can't sleep and they're restless, then get up and do some of these.
Self-care.
Yeah, do some self-care right in the middle of the night. and
Pass the range of motion test.
Pass all the range of
Now,
motion tests.
this is a really great, so today we're going to also do spray and stretch. So here's some of the spray and stretch pictures, and shows the referred pain and also how to do the spray and stretch. So we'll be doing trapezius, and you'll see these interesting positions that we're going to do the upper, middle, and lower trapezius, and how to do the spray, the sternocleidomastoid, the sternocleidomastoid again, the temporalis, and the masseter, and also the suboccipitals and the splenius cervicis here. Yeah.
So
those,
is
so
that a
we'll do
free
those.
chart that comes with the?
Yes, you get that with the spray.
Yeah.
From Gebauer.
Yeah.
I have the picture of their name over here if you want.
Yeah, here's one right here too.
Great, that's perfect. That's better.
Okay, good.
Yeah.
All right.
So we went over our posters and everything. I
Yeah,
think we did it.
that's what
No,
we got. Yeah.
So another thing we use is these Fomentech bags, and we use this a lot for head pain and dysfunction. We use these Fomentech hot water bottles, and they're good for heating up the abdominals, trapezius, all the neck muscles. So these are great. Yeah.
What did
So
you
usually-
say? Oh yeah, here we go.
So here's one of them, and what you do is you fill it up about a third
And
or
Diana
less.
White demonstrating the.
And then,
hot
and
water
then
bottle.
it shouldn't be so hot that you can't put your hand on it, but
Okay.
it's really hot, but it feels really good.
Yeah.
It feels really, really good, and it really penetrates, and they're really great. Yeah. So this is wonderful. Okay, so thanks for filling that up.
Thank
So
you.
we're
Yeah.
going to introduce somebody. We're going to a new model today. Stephanie's on our model today. We have Kelly.
Stephanie's getting better too quickly.
Yeah, yeah.
So we need someone who's not recovering.
Yeah, yeah, that's it.
Just kidding.
So here's Kelly.
Kelly, thank you for joining us.
Good. Thanks for coming today. Okay, so Kelly, so tell us a little bit about. We have a picture here of some of the pains that you've been experiencing.
Yeah, remember that every single muscle has a nice description, and if you get them down, and that's what's really good, because the descriptions for every muscle and the type of pain it causes.
Then you know which muscle is causing it.
You
So
almost
can look at-
instantly know.
So if you see the pain pattern, then you know, oh, that's that muscle. Very likely. But then we'll do the range of motion test to then double. They have the double whammy there. We get both the.
That's
pain.
right.
So we show the referred pain and the dysfunction. Then we know that's the muscle that's causing the problem.
Yep, the 3-step identification is.
So you drew this here, and you said that sometimes the pain is like a 5.
Usually it's more when I wake up. And then
Oh,
it
when
kinda
you wake
goes
up.
Mm-hmm.
That's interesting. So it's more when you wake up.
Or chewing hard, really.
Oh, chewing
hard
too.
food, yeah.
So it goes.
So it's TMJ.
higher. Yeah. So chewing. And waking up. Wow.
And then sometimes there's no pain, but it just.
So that makes you think that maybe you might be clenching your teeth while you're sleeping.
And maybe
Yes.
I actually clench them during the day too.
But
now
it
that
could happen. Yeah.
I'm conscious.
But so at any rate, so that's so what we do sometimes is get you to learn to treat these muscles before you go to bed, and then you don't grind. You stop grinding. So because you put the muscles back in neutral, and you relax them after your day, maybe a day of stress, and then you relax them before you go to bed, and then it's possible that you can stop grinding. We'll see what happens. Okay. So you learn it, and then we'll try it. We'll try it over maybe a couple months, and see if we can get it to stop. You'd stop doing that at night. Okay. We'll give it a try. Yeah.
Yeah, it sounds
Good. Okay. So here is so you've been having a lot of pain, ear ringing on the right, but pain on the left.
On both sides, maybe.
Pain
but
both
more
sides.
on the right.
More on the right. Yeah. So okay, more pain on the right. Okay, and more ear ringing on the right.
A lot more.
Oh, so it's that's more logical.
A lot more, yeah.
Okay, good. So quite a bit. So this right side's has been bothering you quite a bit. Yeah.
Yeah.
Okay, so let's see what we can do with that today. So we're gonna do some little tests, okay? And also I noted that you're treating yourself, but not too frequently, right?
Yeah.
You've been treating yourself, but not too frequently.
It's just
Yeah.
sometimes if I'm on the bus, I'll do it, or if I remember at home. I keep
Okay.
the
And then
paper.
also you're exercising at least 30 minutes 3 times a week. What kind of exercise are you doing?
Different things.
Okay, good. Well, anyway, you're
Yoga
doing some
video,
exercise.
yeah.
So you're moving, doing some stretching and yoga you're doing.
Mm-hmm.
Good. So you do some movement and stuff for the neck and shoulders.
Mm-hmm.
Great. And what kind of work are you doing nowadays?
Babysitting, nannying, so
Okay.
a
Okay, nanny.
lot of lifting. I feel like my muscles are kind of symmetrical because I lift on this side.
Okay, let me see how you hold the baby. Pretend like you're holding the baby.
Like
Kind of
maybe more.
like that.
sometimes it's
You
like
go
I'm
the other side
switching.
too.
Yeah.
Okay, so one side or the other.
But
Okay.
usually this side, yeah.
Okay. Okay, so we're gonna do some of those tests today. We're gonna do a little bit of range of motion tests. Also, take a look at your symmetry for a minute. So if we take this off for a moment and look at your shoulders. So if everybody could go along with me and do these same range of motion tests. Today I'm gonna take a look at the range of motion on Kelly, and then I'm gonna treat her first, and then we're gonna do self-care next. So
Okay, we're
that's
just gonna
how-
switch it up. We're gonna make it.
Yeah, we're gonna switch.
We
it
got a
up.
couple new things. We got spray and stretch today, and we're gonna do treatment before self-care.
So we're gonna take a look, and you can see we have a little bit of her head forward here. So so this is something that we probably want to correct. So usually I'll draw that a little bit. So here, so we make a little drawing here. So we're gonna put heads a little forward. Okay, so we're gonna do that. Okay, so let's see if we can correct that. That's kind of important. Okay, and let's have you turn side. So that could cause all the trouble, is having your head forward. We're just gonna check to see how symmetrical you are. Pretty good. Let's just look at your spine for a minute to see how. And let's look at your hips just really quick. Pretty good. All right, so next we're going to look at, and does she have any nerve compression? So what's the ones that are more important today would be C1 through C6. So we could look at the whole spine, but right now we're going to look, and I'm going to just use one hand. Ooh, that's tight there. So here you can see, so we're looking for, where do we have hypertone? Where do we have too much tone because the nerve is constantly yelling, okay? So here, see here, C1, C2 is okay, C3, oh, but we get here about to C4, really tight, okay? So you can feel it, right? Oh, C6 is super, super, super tight, okay? And then here, so even tight down to maybe T2, okay? So if maybe one of you could do, if you could do the skin rolling for me, because I can't do two, I can't use this thumb. Yeah, so you could do this side. Yeah. You do, yeah, that's it, yeah. You're being one of my hands, okay? Or just look around in here. So it's a little tight here too.
It's tight.
Yeah, I didn't know, slow down. Okay, so especially right here. So we'll want to treat some of these here. And so some of these that cause the eye and the ear pain are tight on you right here. Yeah. So the 4, 5, and 6 here. So we'll look at that. So that's one thing we'll look at. Now we're going to take a look at the range of motion. So we're going to do 1, 2, 3, 4, 7, 8, and 15 range of motion tests. Okay?
Yeah, let's do it.
All right. So there's a couple different ways of doing it. One way is you look and you could measure with your fingers like this. So this is 4 fingers, minus 4 fingers left. And let's look on the right, from the ear to the shoulder, and this side here is minus about 3.5 fingers right. So we'll do. Oh, you're gonna write for me. So okay, here I'll do it. So we're right, 3.5 fingers, left 4 fingers. Okay. So cervical lateral flexion. Oh, that was cervical lateral. Oh, this is rotation. Okay, I have to put my glasses on. Okay, 3.5 fingers and 4 fingers, and then here. So do the rotation. So what we want to do is we want to get her nose all the way here to the acromion.
Okay,
So
let's
here,
see.
so we'll see how good she does. So go ahead, turn to the left.
Sorry to show off, Kelly. Let's see.
Okay, so
tight.
here, see, so for here to here, so we want to get the nose, the chin, the chin to come all the way over to here. Yeah. So here we're missing about, let's see, 4 fingers. Okay. So let's go this way. Let's turn, and here again, about the same. So we want to get this over here, over to this part. Oh, push it a little further. Okay, here, we'll push it a little further. Okay, good. So on this side is just about 2 inches, and the other side is about, same, about 2 inches. Okay, minus 2 inches. Okay, so let's do the flexion. Now again, we're doing it with the fingers again. Okay, so we're gonna go your chin to your chest. Okay, so that's minus about 3. Okay, 2.5 fingers. 2.5 fingers. So we want to get a little bit better. Minus 2.5 fingers. Okay, cervical extension, so you want to get your nostrils up to the ceiling. Oh yeah, pretty good. Okay, one more, just go chin down again, one more time. Okay, one more time, up to the ceiling. Okay, so we could get just a hair better, you know, so it looks like about 10 degrees, maybe about 5 to 10 degrees more. Okay, so the next one we're gonna do is 7 and 8. I'm at 8 and 9. Okay, so we're opening and closing, and we're gonna look at how your mouth opens and closes. So let's do it so everyone can see us. Okay, so we're gonna feel. So let's open and close and open. Okay, so right now that's what we would call trismus, or small mouth opening. Small mouth opening. So she could have a much bigger opening. So we'll probably find a way of doing that today. See if we can find a way of doing that today. Yeah. So that's small mouth opening. So let's have you feel and see what you feel when you open. What do you notice? Do you notice any noises?
Oh,
On this side right here?
yeah.
Yeah. And so do you notice it's opening evenly? Let me feel it again. Say open. Yeah, it's not even. Yeah. So open again. Yeah. So you got this side's lagging. One side's lagging behind the other side. So let's see if we can fix that. Okay.
Okay.
So the other thing is the knuckle test. So let's put in one knuckle in your mouth. How's that feel? Is it painful?
No.
Okay. So let's try 2. How's that feel?
It's okay.
Was it a little bit painful?
Mm,
So it seemed a little bit stretched.
it was stretched, but it
Okay.
wasn't painful.
Well, not painful. Okay. So anyway, we've got small mouth opening, but no pain when you put the 2 knuckles in. Good. Okay, so small mouth opening. Okay. And we got the 2 knuckles in, so that was good. Wonderful. So it opens unevenly, and we have some popping and grinding kind of noises. And would you say that you heard the noises more on this side?
Mm-hmm. Yep.
On the right. Okay. So then we're gonna do one more test, and this is for the upper trapezius. We're gonna do with the thumb down. So I'm gonna have you resist, and we're gonna do this on both sides. So with your thumb down. Okay, good. Look. Go ahead. Look. So start here. So resist and go up. Thumb down. So you can have your thumb like that. Yeah. Resist and go up. Oh, what'd you?
Should I
I'm
keep
gonna try.
going?
I'll give you less resistance. Go ahead. How'd that feel?
Okay.
Was there any pain here?
I might have been shrugging it.
A little bit shrugging. Yeah. So thumb down. Okay. Resist up. Okay, so that seems a little weak to me, you know. Let's see if it gets a little stronger after retreating everything, okay?
Okay.
Yeah, so see if it gets a little bit stronger, yeah.
All right, thumb down for upper trapezius. Otherwise, if the thumb was up, it'd be more deltoid, right?
Yes, that's right.
Okay.
Put the thumb down. And it was a little weak. Okay. All right, so we did a few tests, and we looked at a few things. Now we're going to treat you. What do you think of that? And I might need someone to help me with using my left hand today. So when I need help, I'll ask for some help. So let's see if I can see how good I do today. All right. Oh, one thing we didn't look at, let's just do one more little thing. Let's just look at you seated, and we'll see how you look seated. So let's bring in, Camille's helping me. Thanks, Camille. Okay, let's have you sit here and with your back back towards Justin. Okay. Okay, go ahead and sit with your knees here and your back towards Justin. So I just want to see how you look seated. So when you're working, you don't sit very much, so that it's not going to be much of an issue for you, the seated issue. But you do see her right shoulder is lower than her left shoulder, so it's uneven. Okay, so let's look at the lower part.
And this wasn't so much standing, huh?
No, it wasn't. So this is interesting. So it's lower here. So here, this hip is lower, and this shoulder is lower. So when you're seated in your car, let's have you stand up for a second. So let's just even you out. So if we were going to treat you seated, we probably want to put a little lift onto that side. So we'll start with a really little lift. Okay. So what if you were a piano player? Like you are a piano player, aren't you?
Yeah. A little bit.
So put your
I was.
issue, like sit right on that. Yeah. Okay, let's see if that makes it go up. No, it doesn't. This is too little. Do you know where the rest of them are? Yeah. Okay, so this is a little issue lift. So sometimes some people, if they sit for like, what if you're going down to Nashville, and then you wanted to take a long car ride, then you might want to put this underneath till we correct it.
Okay.
You know, till we correct it. But if you're working with the kids, probably it's not so as important because you're probably not sitting so much. Yeah. So let's try a little higher. So we'll try 6 millimeters and see what happens. Okay.
That's good to know.
So you put under your sit bone.
Oh,
So-
okay.
Okay. Your sit bone and get closer to the edge of the chair more. Yeah. So get it right underneath, maybe a little bit more. So there you go. All right. Okay, let's see if it makes it go up. There. Okay, still doesn't make this go up. Yeah. So it could be that this is not a good correction for you, but I'm going to just go a little higher just to see. So you like to cross your legs?
Sometimes, yeah. I think I do.
So sit right on it.
Yes, ma'am.
Okay, it's coming up finally, the shoulder. Okay, so here, now it's coming up. So this might be important for us. So now that's 7 millimeters. So so let's go, let's say just a hair more. So we'll make it 3 more. So put your sit bone right on that. A little bit more to the right. There you go. Okay, so it's coming up. All right, so
You want a
it's,
9?
oh, she's giving me a 9.
Then you get a 12.
Okay, so one more. Try that. Okay, but you got to get your butt right on it. Okay, all right. 9. We're still leaning a little bit to the side, but that's okay. Oh, all right, she's gonna give me a 12. All right, here we go. One more time. All right, try 12. Okay. So is it on your? Is it the sit bone that your butt? Does that feel like you're on it?
So.
Okay. All right. Let's see. Okay, now that does make it even. The spine looks pretty even. The hips are relatively even. Okay. So now the test is we put it on the other side. So tell me how it feels right now on you.
Fine.
Okay. Let's put it on the other side. So put it under the other sit bone. So get your other. Okay. Now let's see what it looks like. So it makes you uneven. How does it feel?
Yeah, it feels uneven.
Yeah. Okay.
Yeah.
So right now it looks like this amount like a magazine.
Half inch.
That's what I was
Like
thinking.
a magazine would be good on your right side. So, but let's reevaluate that over time. But especially if you're sitting a lot, like a long trip. or
So
you're
Sharon-
flying
That's good to know.
Yeah.
So that could be a functional issue, meaning that
Yes.
a muscle is creating that
It
situation.
could be, or it could be that the bone. It could be that the pelvis is smaller on that side.
Mhm.
So it could be muscle dysfunction causing it. So that's why it would change, or it could be that it won't change because it's really bony, a difference between the two sides. So we just observe it over time, and then we could do an X-ray someday if we felt like it, and then look at see if we improve it. So I'm going to put this here, so you could be thinking about taking that with you today.
And that's, of course, really, really important in jaw issues because the jaw is what they call a sling. It hangs there, and if you're slightly tilted to one side, then it never hangs straight.
That's right.
Yeah.
That's right. So it's important to be even. Try to get you nice and even.
Yeah.
Okay, so we're going to set up the treatment table. But first, we're going to look at the super sensitive spinal segments, the hypertone segments in the neck, and then we're going to treat some of the muscles. Sounds good? Okay.
Mhm.
Okay, great. So I'm just going to take some things off the treatment table here. And I'm going to just give you, while I'm doing this, I'm going to warm your muscles up just a hair while I'm doing this. So you're going to put this on, so this is a nice way to do it. So let's put this on this side, and let's put this on this side. Okay, this way. Okay, so I'm going to set up the treatment table. I'd like to use the body support system. I've learned to use my other fingers. See how you pick up everything with my other fingers? They immediately learned to do something. Okay, so we need a hot water bottle for the tummy. So we like to use a lot of heat, especially for relaxing the jaw and the face, and the ears and the eyes. So we use heat on the abdominals to relax the vagus nerve. Great. This feels good, so we'll do this. Great, thank you, Camille.
Face cream.
What did Dr. Travell say whenever you're working? Or no, it was
Bonnie Pruden.
Bonnie Pruden who said whenever you're working on the
top.
neck, always have to warm the abdominals.
Yeah. Yes, she did say that. Could I lost another. Give me another.
You don't want this to
No. No, because then I can't do this. Okay. All right. So this is set up nice. So we're going to take a look at the C4, 5, 6, 7, 8 in there, and also a little bit lower down. And then we're going to look at those and see if we can get them to loosen up. Okay? And then you could be thinking about how you might do it too.
Yeah.
Okay? Okay, so let me take your hot water, your hot packs off of you, your Thermacores.
You want to bring this down for her to get on the table?
Go ahead and lay on your tummy on the
No, do you want to
table.
lower the table so she can get on? It's pretty high. Okay.
No.
All right, she's just going to climb up.
I'll climb on.
Yeah. Okay, let's come this way. There you go. Super. Okay, so we're making her a seat. Oh, are you comfortable?
I
Okay.
think so.
How's it feel your face there? Is it okay? Okay,
Yeah.
good. Okay, go ahead and put your face down. That's great. So we're going to take a look. Again, now, remember when she was standing up, she was really tight at C4, but here she's not quite as tight laying down. So something about her posture is causing it to be a lot worse. Okay, so I'm going to treat it, but it's not so bad laying down. That's because your posture is actually causing a lot of that tension here. So let's just go ahead and let's treat that, because I can feel it's a little tighter here, right here. It's really loose there, see? That's the loose part. So that's really good there. So we'll do just a little bit of treatment here, and then we'll be thinking, can we change the posture of your head? We'll do head balancing today. We'll do head balancing. So let's go ahead and look right here. Okay,
Sugar point therapists don't need thumbs anyway.
That's right.
They've got elbows.
We've got elbows.
And tools.
And tools, yes. Yep, we do have that, yeah. And we could treat ourselves as well, yep. So here we're looking right along the spine. So we're looking to treat, right now we're just going to treat the multifidi and the rotatorities right next to the spine. So we'll look at the spine, the spinous process there, and we're going to come just lateral to it. Press into that lamina groove and go towards the transverse processes and towards the spinous processes. Then come on up, then come a little higher. Feel the spinous process. Come in, you're going to come right next to it. We're going to treat the attachment of the rotatories and the multifidies there. Treat the muscle, the body right there, and the other attachment over here on the transverse. Then they're going to come up a little bit. So feel with their elbow, feel the spinous process. Come just lateral to it and press in and towards the spinous process, then towards the muscle belly, then towards the transverse process. Now here's where I've used this thumb, but I'm going to use my other hand, so I'm doing that. So it's working. I have another hand. I have another thumb. Okay, and then I'm coming in here and all the way up. Okay, so let's see if it feels a little bit more flexible. Yes, it does. Yeah. Okay, let's go ahead and I'm going to look on the other side. Okay, good. Thank you. Okay, so let's check. That's okay. That's not necessary. Yeah. Okay, so we're going to take a look again. Let's start a little bit about right here. So here I feel a few taut bands right there. right in there. So we're going to go ahead and take a look at those. How's the painfulness of these spots here? You could tell me. So I think let's go ahead and use this elbow. So let's feel. We're going to feel the spinous process. Then we're going to press in. How's that feel?
It's okay.
Press towards the spine. So straight in and then away. What did you think, Kelly?
Well, I think I feel the top band.
You can feel them a little bit. So you can feel them. So can you imagine you treating them yourself? And had you noticed that your head was a little bit forward?
Not really.
Not really. Okay, that's interesting. Good. Good.
But I noticed my shoulders go forward a lot.
Yeah, your shoulders were quite forward. Yes. Yeah. So you noticed that. Yeah. So now I'm gonna then go here to the. I'll go to the thumb. So pressing towards the spine, straight in towards the transverse process. Press in.
And you would say to work on the supersensitive spinal segments first when you find them?
If you can. What if you did them second? That's okay too. I mean,
okay
but it's I tend to do it first.
Okay.
Okay. So, but it's, what if you treated the person and they still had the problem? Maybe I go to the spinal segment then. So you could do it different ways.
Great.
So you could do it first, or if you don't resolve everything, you could do it second.
Great.
So either way, you could do it.
Cool.
Okay, so let's take a look. So today, some of the new muscles that we're going to work on today are the longus colli, the longus capitis, the super and infrahyoids, and the masseter. Okay, great. So I was going to treat those muscles first because we did do some of those other muscles before. So what do you think?
Yeah.
You like the idea? Okay, so I guess if I could. Let's go ahead and let's have you sit up for a minute, and let's take a look at your longus colli and your longus capitis. Okay. Now, we don't have a lot of so just sit up with your feet over the side.
I don't know what those are.
Oh, she's never heard of these.
Just sitting there.
Okay, she's never heard of these. Oh, this is the wrong book.
Wrong book. Aren't they on the deep front of the neck?
Oh, there it is.
This book here.
They are. They're on the deep front of the neck. Okay, so here we are. So we're going to treat the suprahyoids and the infrahyoids, and we're going to be treating the longus colli and the longus capitis. So this is the front of the throat. So this is your throat in the front. So this is the longus colli, and here's the longus capitis here. So we'll be going towards the esophagus and then sort of behind it to treat these muscles. They're very, very, very interesting muscles. They cause significant back of the neck pain, but they also cause really bad eye pain and really, really bad ear pain. So that's why we want to treat them. So really bad ear pain all through here, really bad eye pain, and unresolved back of the neck pain. So that's them. And the other ones in the front that we're going to treat are the supra and infrahyoids. So this is the ones that under the chin, and if you use them to move your tongue around and to help open the mouth. And these infrahyoids also help open the mouth. And we're gonna and we saw that we needed that, didn't we? We needed that. Okay, so we're also going to be treating the sternocleidomastoid. Let's see if we can find that really quick. Let's see if we can. Okay, put my glasses back on again. I can't find things.
You got it.
Oh, there it is. There it is. That's why I can't see it. Okay, so here's the sternocleidomastoid. And so we're going to be treating this, and you can see that it could cause you to have really bad eye dysfunction. First of all, the sternocleidomastoid can come up and activate the oculi right here and cause you to not be able to focus at all. And then also could maybe cause some of that spots in front of your eyes, things like that. Yeah. And you were, what kind of headache you were saying you were having? You said you were having headache.
Well, just today I was having a headache right in here, but
in the
usually
eyebrows.
it's back here.
Okay, so it's the side of the head.
Yeah.
So let's look at she recognized this. She thought this was like her pain. So it was like a composite picture of all the head pain muscles in the same one here. Oh, somebody else will have to find things for me. So I'll show that in a second. Okay, so did you find the composite picture of all the paints? All right, so we're going to take a look at those muscles, and then we'll go on to some others, okay? Okay. So I'm going to have you lay on your back. So I've got these hot water bottles here. And let's put this right there. Okay, go ahead and lay on your back. Put your head right here.
Okay.
Let's scoot up a little bit.
I should take my clip off.
Okay. Okay, and then we're going to put a little bit of heat right here. Okay?
Okay.
How's that feel so far?
Good.
Good so far. Wonderful. And we'll keep these around for something we're going to use them for.
Why is it the heat right here?
Oh, the vagus nerve is here, and it comes up, and it comes up and it starts to relax the whole face and jaw and everything. But it also, the center, if you have the center of your body warm, it makes all of you warm. And then if all your muscles are relaxed because they're warm. Yes, but what? Okay, well, the opposite. What if you were cold? What would happen to the muscles?
Tension.
Tension, right? So I was just saying. So this is the opposite of that. Yeah, yeah. I like it when we have a little bit of music. What do you think? It's definitely good. Okay, so we're going to take a look at the sternocleidomastoid. So this is our sternocleidomastoid. So we're going to use a pincer compression, and then when we work on ourselves, we'll use our hands like this too. So this is pincer. So this causes. So Justin, if you could maybe show the. You could, oh, we just did it. Yeah. So this causes the pain all over the eye, all over the whole eye, and also the top of the head and the back of the head. So this causes a lot of pain and dysfunction, but it's only one of two muscles that causes it at the top of the head. Oh, that's better. I like that.
Yeah, we were missing that.
It's good to have the music. Yeah.
Yeah.
Oh, feel that. What do you think of that?
I feel it.
Yeah. So this is the muscle that very likely could cause ear pain and ear ringing. This is a really common one. It's the beginning at the beginning of all the head ones. Right. There's those red tabs on the left. Ah, I should have put a little sticky note there. So this spot right here, see that was really tight there, yeah, and you notice it. So this would be a good spot for you to treat. Right
Yeah,
there.
that's where I do.
That's where she does. And what do you find when you treat it?
Mm.
Okay, turn a couple more pages. Okay, come over here a couple more. Okay, a couple more. There it is. Okay, so this is Justin. She recognized this is her pain. You know, this is the trapezius. The temporalis together along with a few other muscles, so she recognized that as likely her. Now, I find the most likely muscle to cause head pain is the trapezius, right here. This is your most likely one to cause headache. The second most likely one is the sternocleidomastoid. The third most likely one, masseter. So these are your. So you want to learn how to treat these. It's very important.
Right. Number 1, trapezius. Number 2, SCM.
Mm-hmm.
And number 3, masseter.
Right, those are 3. But then the fourth one is a toss-up, but it's really important. The fourth most likely one would be. Oh, did I move your head too fast? I'm sorry.
No.
Okay. Is the splenius? The splenius cervicis. I can feel this one. Can you feel that? Do you feel how I'm stretching it? So this one is that one that we're talking about today that causes pain from the back of the eye to the front of the eye. And its main job is to turn your head this way, but what I like you to do is to turn it that way, put it on the stretch, and then get right on the muscle and then treat it. So what kind of treatment are we doing today? We're doing a couple different kinds. One, we're doing compression while we're stretching it, and we're doing pincer compression while we're stretching it. Those are the two kinds we just did. So the splenius cervicis is like very likely maybe the fourth most likely one to cause the head pain. Okay, oh, I can feel, so here, see if I pull your head this way, the muscles are so tight they won't let your chin move. Can you feel it?
Mhm.
So it won't let you bring your chin down. So these are really restricting your range of motion. Yeah. So let's take a look on the other side. I think I might have Camille help me to do one thing. Okay, at least one. I'll start with one.
Yeah.
So
Tell me what
Camille,
to do.
if you would hold her head with sit where I'm sitting in a second,
Okay.
and we're gonna have you do the compression. So you're gonna do like this. You're gonna do the squeeze. You squeeze, and you're gonna do it while you're turning your head to that side. Okay, so try to make it more comfortable for you. Okay, I'll lower it down just a hair, and I'll assist you in any way. So hopefully next week my thumb will want to work on that side.
So we're gonna turn our head to this side.
No.
No.
So you're gonna, so for this muscle, the way to stretch it is you turn your head all the way to that side.
This
For the
side.
SCM?
So it's
Oh,
sort of
the
anti-intuitive.
Okay.
So you're gonna do compression, and then you're gonna, yeah, that's it, yeah. Yes, and you're gonna see where the part's restricting it from turning. So that's the stretch for that side. For the sternal division.
Mm-hmm.
The stretch for the clavicular division is the other stretch, the one that you first turn. So I'm just starting with the sternal division. So what you want to do is really make sure that you really lengthen it. So you stay this way. You're going to take it and really get this muscle right here. It's all the way over here, see?
Okay.
And you're going to really make sure that you get that really. Okay, what do you think of that, Kelly?
Oh, yeah.
Okay, so we're really stretching it. So it attaches over here on the mastoid and attaches over here in the sternum. And when you really lengthen it,
Okay.
you turn the head to the same
Exhale
side.
and relax. A little bit. Exhale. Just one exhale.
So Camille, you've been an AMT member since 1982.
Two AMTA members.
Yes, I've been an AMT member since 1982 also.
Okay.
Imagine that. Great.
So we got a little more movement.
Yes, I think you did. Yeah. Great. Thank you. Okay, so we're going to go ahead and take a look at another muscle. Okay, I'll
You're gonna
start and then I'll maybe have you do something. How was the positioning for you? It was okay? Okay, good. Okay, so we did our sternocleidomastoid. Now remember, this one can come up here and activate the ocularis oculi. So that's one of the muscles we're going to treat today that we hadn't treated before. So let's take a look at the ocularis oculi, and we're going to do several different ways of treating it. We're going to just go right. Oh, maybe you'd like to show a picture of the
sure.
referred pain.
Would you like to show me the ocularis oculi?
You can find it.
It was she had it already.
All right.
There it is.
There you go.
So see the kind of pain that it causes?
Yeah. Okay. So that's a lot of eyebrow pain.
And down the nose a bit there. So we're gonna go right on the eye socket there, right on the bone. We're gonna press onto it. What do you think, Kelly?
I definitely feel it.
Now I know that Kelly's main problem isn't in her eye, but these are a lot of the same muscles that cause her ear ringing and ear pain and neck pain are also the same muscles that cause the eye pain and dysfunction. So, I can feel these. You feel them?
I don't know if tender is the right word.
Tender is the
but
right word. Yeah, I feel
yeah.
it. Yeah, yeah, it's
I
tender there.
didn't think I had pain
Uh-huh.
there.
Yeah, you didn't think you did, no. And these could cause pain all through the eye, down the nose, over the eyebrow. Okay, so let's see you open your eyes really wide. Oh, really, really wide, like surprise. And then squeeze them down low. Really, really squeeze, squeeze, squeeze. Okay. And how's that one we've treated? How's that feel?
Feels good.
Good so far. Okay, so next we're gonna do a little different treatment. So we're gonna go right on the edge of the bone there, the eye socket, and then we're gonna roll in and press. What do you think of that, Kelly? Interesting?
Yeah, feels like a headache almost.
Oh, like a headache almost. Wow. So we're going right onto the inside. So, those of you in Indianapolis, and those of you in Nashville, and those of you in Hawaii, and those of you, of course, on the replay, you could treat each other. You know, you could all start together, do the range of motion testing, do the perpetuating factors testing, and then start in on the nerve root, on the ones that they didn't pass, and then you could go ahead and treat in the same order that I am today. Okay, so here we're going to roll in and into the socket there. Let's go ahead and roll in. And let's go ahead and roll in. And roll in. Good. Okay, so let's open your eyes, really surprise eyes. Wow. And now squeeze them down tight, squeeze them down tight. And surprise. Okay, so when you do surprise, let's open your mouth. So let's open everything. Open. Okay, good. All right, so how's that feel on this eye compared to that eye now?
I think it feels better.
Okay, good. Okay, just interesting. Just wondering what you thought. Okay.
It feels
So let's go ahead and we're going to do the eye socket. So just go around the whole eye opening here where the bone is. We're going to go around it.
Visually, you look more surprised on the right. The left wasn't quite as surprised. So it seemed like the surprise was coming from the right. Happy birthday. Only on the right side.
Stephanie, could you bring the Travell book over here? Good. So just once you put it right over there. Good. So we can look at it real quick.
So Sharon, were you saying that there's two techniques for treating the, I can't pronounce that muscle, orbicularis or
Oculi.
Oculi, whatever it is.
Well, okay, so first one is we're just pressing straight in, and the second is we're going to press in and pull the muscle inward and like stretch it.
Okay.
So we're going to pull the muscle inward and press in and stretch it. So one of the things we're doing when we're doing the compression is micro stretching the muscle right where it gets all compressed. Mm-hmm. So we're pressing in and we're micro stretching it, and then when we move it, we're macro stretching it. You know, so we're doing the micro stretching before the macro stretching. So coming through here, these are hard here. Can you feel it?
Mm-hmm.
They're really hard. So you can feel like it's like, for some reason, you got these muscles not working completely.
You need more surprises in your life.
Yeah.
She's ready. She's ready. She's thinking, yeah.
Surprise me.
Oh. And then, so here we're going to just roll in a little bit more. So come this way, grab and roll in. We're going to grab and roll in. I can do this without my thumb. So some things I can do without my thumb.
Mm-hmm.
Like eat chocolate.
Okay, so we're just going to go around and give it a tiny, itsy bitty little massage. Okay, just go around a little bit. So I got my aesthetics license back in 1979. Aesthetics. I'm an esthetician, and this is one of the first things we learned to do. Okay, so let's see you. Surprise! And open their mouth.
Oh, much better, much more surprise.
Okay, and squeeze them down, squeeze them. And lemon face, lemon mouth, lemon eyes, everything lemon. And now, surprise! Okay, good.
Good.
Okay, good. Okay, so that was good. So do you think? What did you think? After I did that, do you think you might be able to do that on yourself?
Mhm.
Mhm. And do you see a little differently? You notice anything? Oh,
Well, I don't know if I.
okay. Anyway, you could think about it. Yeah.
It feels a lot more relaxed now.
Yeah, this was real tight on that side. Yeah. Okay, so I can imagine it would feel more.
You're gonna have to watch the replay when you were more surprised than the right. You looked really surprised in these last couple shots. This is
Yeah,
English is
that's-
surprised.
Yeah.
So here we're going to
Well
take a look
done.
at the masseter, and if you want to open the masseter page to us and put it right here, and Justin could look at it
Yeah.
on the camera. Okay,
Masseter is
so
number,
here's
number
our
4 most likely. Yeah. For this to
oh,
cause.
so the most likely muscle is the sternocleidomastoid. The second
Right.
most likely muscle is the temporalis.
Yes.
The third most likely, let's see, and the fourth most likely.
Medius
So a little further
cervicis.
down. Masseter is a little further.
Yeah,
okay,
masseter
so
is
third.
number 4.
4. Yeah, number 4. Okay, so here it causes a pain in the teeth, the upper teeth. It causes pain in the lower teeth. It causes cheek pain. It also causes eyebrow pain. So pretty significant pain in the headache pain in the eyebrow, and chin, and it causes pain into the ear. Here, so this is going to be. That's why these same muscles that cause eye pain here, many of them also bother and cause ear pain.
Mhm.
So we're going to take a look at that one next.
Now,
So
would
the
that
re-
cause
the
you
ones in
ringing
the
the
re-
ears too?
It really could. It really could cause the ringing in the ears. Yes, definitely could cause ringing. Anything that refers to the ear could likely cause the ringing in the ear. So the others. Let's look at the sternocleidomastoid one again one more time. So the clavicular head here goes right into the ear, and that's another one that could go right into the. So we treated just the sternal division. We'll also treat. We'll see the clavicular. We did it already the other day. Let's do it again. Okay, so we're going to look at the masseter, and let's feel in this position. We're going to look at you opening your mouth open and close, and open and close. Yeah. So it's moves a little bit to the right. Okay, so we're going to do something that you could do at home. Everybody, you could do pincer compression over the masseter. So we're going to do this pincer compression over the masseter. So this is a really good way to get started.
Sometimes they call that the superficial masseter, right?
We're sort of getting a little bit of the superficial masseter by doing it this way. Yes, correct. Yeah. So here, what do you think of this part right under your eye there? Right there. Okay, let's take a look.
Pinches.
So let's have you try it on the other side. So go ahead and you do the
Do you want me to do it on this?
Oh, well, you could do
You
it.
want to teach her to do it?
I was going to teach her
Teach
to do
her
it.
to do it.
So I just came up to but I
Yeah.
should have had you do it.
No, teach her
Okay,
to
go
do
ahead.
it.
You go ahead. If
Definitely.
you just go ahead and do the pincing. So right there. So pinch. Yep. What do you think? Some painful spots. So what's happening when you find that it's painful? Is you've got keep going. You've got painful chemicals stuck in the tissue.
Oh.
When you're doing this compression, you're squishing those painful chemicals out, and then passively the blood supply will go in, and then the blood supply has got minerals and vitamins and everything in it, and it's really good for getting the muscle to relax. Yeah. Okay, so
I feel like you were
Yes,
more
right there.
exact and pressing a lot
So
harder than I can.
oh,
Or
okay.
than
So
I am.
I could press a little harder than you can. Yeah.
I probably can. I just have to do it.
Okay, so can you do a little bit this side? So why don't you go ahead and we're going to do, great, thank you. So a little bit of the pincing. So this is pincer compression. And some of the chemicals that get stuck
Right
in the
there.
muscles is like substance P. So that's
Feel it
like
right
substance pain, yeah. So we're squishing all those painful chemicals out of the tissue. Okay, so now I'm going to go a little deeper. So now we're going to go right at the angle, and if you wanted to show right where it attaches, we're going to go right here at the bottom, and we're going to feel the bottom of the muscle and roll up and press and grab the so if you look at that one, the very bottom one here is the one that causes the eyebrow pain. So way down low, so that's where I'm going to go now because it causes the eyebrow pain. So it goes really low. So that's where we're going to go and press in right there. So that's our eyebrow pain one. What do you think? Eyebrow?
Well, I feel it on where you're pushing.
Okay. Usually when I'm pushing on one side, I hold the other side so I don't push their jaw over excessively. So here, finally the bottom, I'm going to roll up and press in. What do you think of that one? So it's surprising that just really low like that, you could find some trigger points there. No, really low.
I feel it.
Yes, right?
Mm-hmm.
You're right, really low. Now let's go behind the angle of the mandible. Let's go forward and get onto those points right there.
So you're rolling forward onto those?
That's right, rolling forward,
Nice.
yeah. So we're capturing, you're grabbing the tissue and capturing it against the mandible.
Mm-hmm.
So there, I've got right on the mandible there. So last week, I fell down on my thumb.
Ouch.
Yes, and I bent the distal phalange. I dislocated it and bent it backwards.
Ooh.
So I'm recovering from that, and over time, I'd like to show everybody how all the different things that I'm doing to get it to recover. But right now, I'm trying to get the skin to heal. So today is the skin healing day.
When
still.
did the stitches come
Last?
out?
Oh, it didn't come out yet.
They don't come out?
They will.
They
Either
will.
Thursday. Stitches
Thursday.
come out Thursday.
Okay.
Yeah, I think one or two fell out already. Okay, so here on this side.
Somebody's been naughty.
So yes, I pulled on them somehow.
I don't know how.
Okay, so here I'm going the bottom of the mandible there, and I'm going to roll up and press it against the mandible. What do you think? Notice it?
Mm-hmm. Yeah, definitely.
So
More
what's
on
the action of this muscle?
Jaw closing?
Yes, it is. It's jaw closing. So it's one of its, and also remember it refers into the teeth. It's a major one of the teeth. But today we're more concerned about the referral to the eye. So we're right on it now, I think. What do you think?
Yeah, it's really painful there.
It's really painful there. And this causes, I found that I had to fix these muscles to get rid of my headaches. I had some very bad headaches, and I found that I had to treat these face muscles if I was going to get rid of my headaches. So it was really important. Now, the trapezius was important, but I had to also do these face muscles. Yeah. Okay, so let's see you opening. Let's feel the opening. Oh, that was a little different. Okay, it opened. Wow, we're starting to get
It
a
is
bigger
better, I feel
bigger
it.
mouth opening there. Okay, that's good. So we're starting to do a little better. So now we're going to go in the middle of the masseter, and let's take a look at that picture, the referral for that. So this one here, so we're going to go a little higher and also a little higher. So we can see that those go into the upper teeth and the lower teeth. So we're going to treat those next, and then we're going to go right next to the ear and look at the one that goes into the ear. Okay.
So there's basically 4 regions to treat with the
That's
masseter?
right, that's right. That's
Oh.
correct. Thank you for
Oh.
noticing that.
All right, I can count.
Okay, so I'm going to press in on both sides here. What do you think?
I feel it.
Mm-hmm. Good.
Feels
So we're looking forward to getting that bigger mouth opening there. So Stephanie, what do they sometimes call small mouth opening? Trismus.
Christmas?
Well, it could be called that, or it could just be called small mouth opening.
It's like Christmas without
Merry
any surprise.
Without the gifts.
That's not fun. That one.
Never look at Christmas in the mouth.
Oh, I love it.
Okay, so we're gonna go now. We're gonna go a little. We're gonna go back to the back of the angle of the mandible here, and we're gonna go forward a little higher now. Okay, so I'm pressing in, and I'm using a nice amount of pressure. But the way I do the pressure is I touch it first, and I notice the taut bands. Then I go slowly in, kind of like a drill press. So it's a sort of. I guess that's bad. We don't say that. Okay, it's not a drill press. It's just like nice pressure.
Nice compression.
Okay, so here, so let's do a little bit. Let's open a little bit and while we're doing this, like open and close, and open and close, and open and close. Yep, yep. And open. Good. So these are a little painful.
Mm-hmm.
Okay, how
Yeah.
painful are they?
They're pretty painful.
You notice them.
They're noticeable. Yeah.
She notices
More
them.
than noticeable.
More than noticing. That's what you call painful. So we'll massage them a little bit. Okay. So this is one of our most important ones that we want to do for ear pain, ear ringing, and for eye pain. This masseter muscle. So it's good that we're doing it. So we give it a little bit of massage along with the pressure. Okay. Now we're going to go right. This is the one that goes more into the ear. So we're going to go right next to the ear, right underneath the cheekbone, side of your medicus, to go right underneath it, and we're going to press in. Oh, she notices this one. Yeah, the feet were going. so this one, like, open a little, and close, and open, and close. Let's see it side to side. Because we're also getting the pterygoid there. Okay, so I'm going to go a little bit more anterior, right there, and open a little, and close. And a little more anterior, and open, and close. Good, and open. Good. Okay, so what do you think? Do you think you might be able to do that area there yourself?
Mm-hmm.
Have you been treating yourself?
Mm-hmm, but mostly the neck.
Oh,
and
just
then
really,
some
really?
up here, but
Okay.
not.
So, Stephanie, do you think you know where the gloves are? So, that'd be great. Okay, so we're going to take a look at treating a little bit from the inside and outside at the same time. Okay. Have you tried that?
Uh-huh. Mm-hmm.
And
I
you,
did.
And you liked it a little?
Mm-hmm.
Good.
Sometimes I really feel it when you're pressing there, and I was thinking if I did it myself, I'd be afraid of causing some kind of damage. But I trust you, so.
Oh, I see. Oh, I hope we got the right kind here. Let's see which size. Okay. So we're going to take a look. So here's our protocol for the, you've got it there? Okay, thank you. Okay, so here is what I usually give the patients to take home. Well, you should relax. So this is for them to look at for a second. So here we're going to do this section here. We're going to go in. We're going to squeeze with our hand inside. And this is what I would recommend that she does every day. And here we did the sternocleidomastoid, and we did the pincer compression on it like that. Okay, so let's go ahead and let's treat from this way. So let's see what we think. Okay, so it's a little scary. Okay, so here we're gonna just treat the face a little bit, because I saw a lot of tension in the face here. Feel it?
Mm-hmm.
Oh,
Yeah.
a lot of tension here. So this is your smile muscle. We did that a couple weeks ago, but I can't help it. Okay, all right. So here, let's look at the masseter. So here I feel the mandible, and I feel the masseter. So I'm going pincer compression now. So here we're going to pinch like this. Now, many times in some states, they don't want you to go into the patient's mouth. So then you could train the patient to do this on themselves. So that would be a good way. So they don't have, you don't have to go in the mouth if you don't want to, and or your state doesn't want you to do it. Okay, what do you think of that? This pincing part? See,
Yeah.
interesting.
Mm-hmm.
Okay, so
Yeah.
it's somebody's other's hand, maybe for this side.
gloves on already, so.
Stephanie, come
So I
here.
can do it.
Come, Stephanie,
get a
come
glove?
here.
She's ran
Where
out.
does Stephanie go?
She's getting another glove.
Okay. Those are smaller. I
She's
hope,
already has her
hope
glove
they were
on.
good for you, Stephanie. Okay, good. So let's go ahead. We're gonna go on this side here.
Right here?
Yep. And you're gonna like feel the mandible, and then you're gonna get over here, really get on the muscle, really grab the muscle. Yeah. So you know where the masseter is, right?
Yes.
Okay.
Oops, sorry.
Okay.
Yeah, I'm fine. Sorry.
So you get on the mandible there, and then you get right on the muscle here.
Okay. Is that hurting?
Menza. Okay, good. Okay, let me take a look. Okay, so, and relax your mouth a little bit right there. Yeah. So now, I'm right on it now. Can you feel that?
Mm-hmm.
So I'm giving you a really good pinch. Okay, good. Now let's see you open. Oh my gosh! That's opening. Okay, so good. So that was good.
Okay.
So we looked at a few of the muscles that would cause noise in the ears and also pain in the eyes. So that's good. That's good. We're gonna a couple more to do. Okay, so we're keeping you nice and warm. How do you feel? Warm
Good.
enough?
Yeah.
Good.
warm.
Good.
Yep.
She's feeling warm. All right. So we're gonna take a look at another muscle. Let's see. Okay, so now we're going to look at the supra-infrahyoids. So again, we're going to do some of this general pincing. So this is a nice, so what if at night you didn't have much time, you're tired, and you'd like to do the self-care, you could just go ahead and do pincing like this. And you could get the supra, so we get the suprahyoids like this. So these muscles open the mouth. So if you have small mouth opening, this would be muscle could stop you from opening it. So this would be the suprahyoids. And they attach here underneath the chin and then over to the hyoid bone right there. We'll show a nice picture of it in a minute. So what do you think of that? You try now. You go ahead and try. Right under the chin. Mm-hmm. And then try to open your mouth and feel see their contribution to opening. Like feel, that one's making it really open. Oh, like that. Yeah, see? So you can do it.
Yeah, it's really
Okay, so here's our suprahyoids and here's our infrahyoids. See how they're attaching onto the floating hyoid bone there, and these assist in opening the mouth. So this is what part of our thing. We're trying to get this to really open here, right? Okay, so now we're going to do so now we're going to feel the esophagus here, and we're going to treat this infrahyoids right over it. What do you think of that? Now okay, so what's interesting about these is they cause really bad eye pain. Isn't that crazy? So they cause really bad eye pain and really bad ear pain and pain around the neck. Okay, so we're going to take a look at it right now. So let's take a look at, so for this we're going to grab them and pinch them like this. Interesting? I bet you're going to be able to do some of the tests better after.
Yeah. It feels sore.
Okay, and then we can also come underneath the mandible and then come this way. Okay, that's also the medial pterygoid, so maybe so right there. What do you think of that?
I feel it in my ear.
Okay.
That.
So these, like I say, these all go into the ear. Oddly enough, who would ever think these would go in their ear, right? But they do. They cause referred. They can cause referred, and then they could start the little tympani bones vibrating, and then they could get the noise. Yeah. So we're coming right underneath the hole, right there, and then I'm going to come around like that. And we're getting all the attachments. Let's come over here. Okay, so, oh. I can use my other hand. Yeah, okay, so, Zenon,
Yes.
could you come over and take the camera? So, you wanna go ahead and do it? So go ahead and you're gonna do, let's have you treat all the, infrahyoids on that side. I was gonna use this thumb. Okay, so really grab a hold of them. So let's start this way. Let's go right over the esophagus here, okay? And then really, now you know you're right on them. Now the sternohyoid right now. Mm-hmm. Yep. Great. Start low. Great. Then come up. Keep coming up right to the hyoid. Mm-hmm. Wonderful. Good. Okay, let's go a little bit more lateral, right here, right there. Mm-hmm. So medial to the sternocleidomastoid, though. So inside. Now let's feel you. See, she's doing that muscle. Now feel. Open your mouth and see how this muscle is making your mouth open. Okay, open. Good. Keep opening. Yeah, and feel how that muscle's working. Feel how you're using it. Try to use it. Can you feel yourself using it? Yeah, you're using
feel
it.
that one.
Now you just did it. You just did it.
Yeah.
See how you're not. So you weren't using them for some reason, right? You weren't using those muscles. Now you are. Isn't that great?
Yeah.
You're starting to really use them.
Okay.
Great, super.
Anything else?
Okay, so let's feel you open, open, and close, and open. Good, and open, and open. Good, and open. Good, great. So we're getting some good opening.
Oh, I didn't get
Okay,
all
so-
the way up here.
That would be this. That would be the suprahyoids. Yeah.
Okay. Do an open and close? Oh, yeah, I can feel that.
So these actually do the opening, whereas the temporalis and the masseter are if they're too tight, restrict the opening. These actually do the opening. Yeah.
Okay.
Yeah. So we'll put a little heat on them after we did all that.
Okay.
Well, warm them up a little bit. Make them a little happier. Okay, so we did quite a few different muscles there, and those are all things that you could learn to do on yourself. And I was suggesting, some ideas that you might do it before you go to bed, and then maybe you might not clench as much. Do you also wear a guard to keep your
No.
Okay, so you don't. So, but your teeth are okay, pretty much.
I
So
think-
far, so good?
Well, so far I think they're okay.
Let's look a little bit. Great. Okay, so far so good. Okay, good. So the teeth are still good. Good. So you don't have to worry about it. Okay, so another muscle we're going to treat is the sternocleidomastoid, but the clavicular division. So that's the one that goes into the ear. Okay, and causes balls of pain right here. So we're going to treat that for a minute. So let's go over here. Okay, so here it is. So this is the one we just did earlier. Now we're going to do the one behind it, right behind it. This one right here, and we're going to treat it while we're stretching it, right there. So press right onto it. So we're stretching it and pressing on it at the same time. This is one goes into the ear. What do you think of that one?
Are you just pressing in, or are you pressing down also?
I'm pressing in towards the the center of the throat. So we're right on the muscle. So the muscle goes from here to here, and we're working right along it, pressing in. You notice that?
Yeah, my arm, my shoulder blade.
Okay, so then if we're feeling the shoulder blade, we're also on the scalenes. Okay, so we're a little bit too posterior, so we go a little bit more anterior, and we get off of that one, most likely. Yeah. What do you think of that? Yeah, we're on it.
I don't feel it anymore.
Yeah,
though.
yeah. So that's a sign. So if you notice that it's going down the arm, you're on the scalenes. Okay, and it's good to treat the scalenes, but maybe if you're trying to treat the sternocleidomastoid, then.
I feel that in the top of my head.
Okay, we're right on
Oh,
that.
like
Yeah,
a
yeah.
headache.
So we're on the sternal division. Yeah. So these are all important to treat. If they cause the referred pain while we're treating you, then you know that they're definitely bothering you. So the way to treat them is we're gonna turn your head to this side. Yeah. So one way is to treat this part while you're stretching it this way. So turning to the same side, and treat the posterior section here. You're treating it while you're tipping your head to the other. So you could just do both. You know. See it right there. So this is the one that goes here and here. This one here goes all around here and to the top of the head. Okay. Okay, so let's look at the other side. Okay, so I'm going to just go ahead. We already did the one where we did the pincing.
Mm-hmm.
Now I'm just gonna, I'm gonna do this one here. I got my little fingers.
Your
My little fingers work for this. So here. Oh yes. Yes. So what do you say about this spot?
It feels hard.
It's hard, right? So it's petrified. So anyway, it's filled with lots of painful chemicals right there. And it got hard, but we can get it to loosen up again. It's going to loosen up and relax. But I was significantly hard, yes. Yeah. So often that happens, yeah. So we're just going to correct that, yeah. And then we're going to give it a little more stretch. Okay, good. All right. So just take a look. Okay, so we're just going to see your mouth opening and close and open. Good. Okay. And we're going to just do a little bit more underneath here. Good. Okay, so another muscle that we did not treat last week is the longus coli and the longus capitis. Oh boy, this is an interesting one. So someone wants to show our picture. Okay, so the longus coli and the longus capitis, not pulling your hair or anything, right?
No.
But I'm trying to unbend the back of your head.
Oh.
And you're bending it again. Like so I'm trying to take this part and not have it so bent.
Mm-hmm.
So the two of us are arguing.
Sorry.
Okay, so here again is our longus coli and our longus capitis. So here's our longus capitis right here. So it's a little bit, the longus capitis attaches onto the transverse processes, and the longus coli more onto the vertebral bodies right here, and then up to the base of the skull, the occiput. Okay, so we're going to take a look. Now those muscles are right here. So the way you find them is you find the esophagus, and then you're going to go behind it, and I'm going to shorten it and lengthen it, and shorten it and lengthen it. That's good. It's working. Okay, there, a little bit of dysfunction. And there, good. So I'm going, and it goes, they attach all the way down to around T4. So it comes all the way down, so it comes way down low right there. Okay, sorry. Okay, what do you think? Interesting?
Mm-hmm.
Okay.
Interesting.
Okay, so this one, where does it cause pain? In the eye and in the ear. So, and unresolved back of the neck pain. So it causes pain all over the place. And we'll check other people's. Let's check yours, and we'll check other people's and see what we notice. So let's see on this side now. A little bit dysfunction right here. Don't you notice that? Yeah. So it doesn't want to do that job. Can you feel it? Right there. Oh, we didn't take the 10-minute break. Okay, we could do it. We'll take a 10-minute break, and then we'll do the self-care and stuff. Yeah. We should have taken it already. Okay, so here, do you notice this? Do you notice any referred pain from this? I can feel it. Yeah. Now we're gonna do the longus capitis. Okay. So here we're coming up, and see how this is its range of motion. So I'm treating it while. So this technique here, we're treating it while we're taking it through full range. Right there. Right there. Right there. Right there. That's your longus coli and your longus capitis way here. Right there. Longus capitis goes right here. Okay, so let's look here at the back of this. Since we're fighting, the back is fighting with me. So we'll take a look at that for a minute. So remember last week and the week before, we treated the suboccipitals, so that we'd be doing that here, and then also we treated the temporalis. That was important. So let's do that one more time. Let's go ahead and let's treat your temporalis. So I'm going to go ahead and start right here, just right above the zygomaticus, right above the cheekbone, right there. I'm going to press in and go ahead and open and close, and go ahead and open. Good. And open. Good. So notice what spots make it feel like opening more. So see whichever spot, like, oh, that's this one. Oh, that one makes me want to open more. So when you're treating yourself, you could look at yourself in the mirror, or just feel it, and go press on different parts of the temporalis, and then notice, oh, I can open my mouth more when I press there. Okay. Okay. And also this part here, let's go side to side. So right back here, move your jaw side to side. Open a little bit, side. Let me feel it again. Go ahead, side. So this section right here. Now, and let's protrude and retract. Let's retract, protrude, retract. Okay, good. Right there. Okay, good. Okay, so let's go a little more anterior. I'm gonna press here. And open. And close. Good. And open. Good. And open. Great. Oh, great. You're doing good. Open. So this part here, let's feel you touch your front teeth. Can you feel how they're working?
Yeah.
Okay. That's this one right here. Let's open and close and open. Good. Oh, that's really great. You did that really good. All right. She did it good. All right. So another one of the muscles that we want to treat is the trapezius, but we did treat those in the last. We're gonna do you're gonna go for the break.
Do you want to take a break now?
Should we do it or not do it? What do you think? We should do it. All right. We're gonna do it. We're gonna take a break and then come back. Okay, come back in 10 minutes. Okay, relax for a second. Okay. You're gonna get up there. You're gonna lay down, okay? So when you're gonna get up, you're gonna always lean you're gonna turn to one side. Don't lean with your neck. Is that
Roll
safe?
over.
So just roll slightly to one side. Yeah. And then roll over, that's it. Okay, use your hands to push up. So that helps to protect the muscles that we just treated.
Oh, okay.
Yeah. Good. Okay, so how's it feel so far?
It feels better.
Good.
Yes, actually.
Starting to feel a little better. Okay, good. Okay, so we're gonna do a few things here. Does it hurt? Just lift it. Yeah, very good. Can you see it? There it goes. Yeah. We
You're just gonna use those two?
Yeah, it's fine. What'd you say?
Electric fans.
Yeah, electric heating.
You get those.
These, they hit the little drugstore that you come off the elevator.
Oh,
sells
really?
Them. He sells them, yeah. They get really hot.
How much are they?
If you get them online, like $40, he sells them for $75.
For each one, or?
Yeah.
That's a difference.
Yeah. Oh, we're on the 10-minute break. You know.
Shoulder blades.
Well, it may be winter. It may be fall. I might have for nothing. But baby, I'm gonna be there whenever you call. Whenever you call. Every time I say
Oh, maybe I could work this on you too. Maybe it's
I think
It's very tiny.
Maybe the
the way you love.
Oh, yeah.
Some of these things. It's just like, my mother's got that hip pain right here.
The way
She
you
does?
love.
Yeah, right there.
Well, it could be the so it could be the master,
Through
but the lowest part, see this low section right there?
Yeah.
It goes up to the
So the left and right and right.
yeah, correct.
That's very intense when you were saying that part. I was like, oh. What? I did it, tried to do it when you told me to, and I felt like, well, I could press harder on myself, but I literally did.
Thank you very much.
Yeah,
That's strong.
it's so precise.
Yeah, I know, because I know just to reaction. Oh, thanks. How's things? How's things?
How do you uncompress the nerve?
What is it?
How do you uncompress the nerve? It's right there.
Well, my baby, she wrote me a letter. She didn't call me on the phone. 5 little words was all she wrote. She said, see you later, I'm gone. She had no explanation about why she had to go. Well, I can't take a joke, but I can take a hint. She don't love me no more. Well, nobody loves you, and you feeling like dust on the empty shelf. Just remember that you can love
How did I go
yourself.
right?
Hey, now.
150 years of body work. How did I?
Well, my mother said that she loved me, but you know she could be jiving too. And everybody's always criticizing everything that I do. I work 9 to 5, I do the best I can, try to please the boss. I bought a big old house and a brand new car, y'all, and then he laid me off. Well, like dust on an empty shelf. Just remember what we're gonna do. Yeah, you can love yourself. That's right. That's in New York. There's lots of things you can do. You can go get yourself dinner, you can shop, take in a meal. You know what I mean? Really love yourself. I'm gonna tell you a story. It's not a good story, but
You don't have to press harder than it's working. It's working.
let's go and do this. Now every time I meet a lady, I wanna try to get to know. Either I'm too small or she's too tall, y'all. Or she rich and I'm poor. So I call my old friend Hazel May. I asked her out for a little date. She said I'm married now and I got 3 little kids, boy. You're just a little too late. Well, now I know nobody loves you. Feeling like dust on an empty shelf. Just remember, well, now you can love yourself. Oh, no, nobody loves you. Feeling like crumbs on an empty shelf. Just remember, well, that you can love. You can hug yourself. Jump back and kiss yourself. Well, ain't nobody business, no. Thank you very much.
Okay, you're more even now. Yeah. You're not all uneven like you were before. Okay, let me just look at the other thing. See, all even now.
I was
Okay.
thinking.
Daddy came around every once in a while, but Mom, she was there all the time. Summertime in Compton was not like TV, but we were right there within the beat. And the Thurman boys on Peach Street was on every day, so proud of themselves and that old body that they had. Miss Brooks, her Bible, her 3 little boy, at the double white Baptist church, singing the joyful love. There's more than one. Oh, ain't no right way, ain't no wrong, but live on the road. You may be, you find your own way, 'cause there's more than one way home. I got me a job at the grocery store, working weekdays after school from 5 to 9. Tommy, John, and Charlie were the neighborhood stars with their mid-sized homes and their big fancy cars. When it was hot on Friday, I'd go out to play, wasting time on the side on the dock of the bay. My ticket to adventure was a ride on the bus. Different places, they were just like
right, Sharon, are we ready?
Yes, we are.
Okay, so once again, we've been looking at pain key number 5.
We have.
Oops, wrong side. And a lot of these muscles we have covered before. And so you can review the last 2 classes, which are up on our YouTube channel, NSCA. Just search National Self-Care Alliance or NSCA on YouTube, and you'll find our channel. Or you can go to myopain.com, click on the registration page for this class, and the link is there as well. So, but we did the new muscles, and we reviewed a couple. And what we promised you is we'd also show you this spray and stretch technique as well. So with the last 20 minutes we have here, let's
Also, tell us how you're feeling after we did the treatment.
Better. Good.
What?
I do feel a difference.
What do you notice?
Less tension.
Less
in
tension
my face.
Good. Good. Less tension. Great. Super. Okay. So one of the things we can do is we can do spray and stretch. So this is a nice really something you could do. You can get it from the Gebauer company. So this here. So here's the Gebauer. Oh, we already said that earlier. Yeah.
Yeah.
That's it. Okay. So what you do is you're going to spray over the trigger point and then over the referral pattern. So the most likely muscle to cause eye pain is the sternocleidomastoid sternal division. So we're going to go ahead and we're going to spray it. So we're keeping her nice and warm. She's got her. Usually we might put some heat low down here too in the hands. Okay. So we're going to spray it while we're stretching it. So here we got it stretching, and we're going to go ahead and spray like this while we're stretching it. And we'll go at least 3 right next to each other. And again. Just overspray down here a little bit. And then over the places where it refers. So I'm going to just go ahead and protect her eye a little bit. And then you're going to go where it refers in the face. Okay. Good. Okay, let's go ahead and turn again and see how we're doing. So are we getting a little closer to the acromion?
Oh yeah.
Looking to that. Okay, let's go ahead the other side. So we'll put the heat over here. We're going to take a look at the sternal division that causes pain all around the eye, the top of the head, back here. So we're going to take a look at that. We're going to look at we're going to spray it while we're stretching it. So this is a stretch enhancer. So it's going to be stretching it. So here we're stretching it, spraying it while we're stretching it. And coming up here, all the way up to where it refers. And where it refers and up to the top of the head. Great, and then we're seeing if we can get a little more stretch. Good. And then after we do it, then we put a little bit of heat onto it. So go ahead and warm it up a little bit. Okay, now we're going to do I'll warm it up here too. I get this. I can feel. Then we'll go a little bit around the eye, like I did before. Okay, let's go ahead, and we're going to do its referral around the eye. We're going to protect the eye a little bit. So go ahead and turn. Here we go. So here we're going to come around, and we're going to go all the way around the eye. And okay. All right, and then we'll warm it up a little. How's that feel?
Good.
And then we're going to turn while we're stretching. Yeah. Okay, and let's do it on the other side. Let's put a little heat right there. And let's go ahead and turn it to this. So we're using cold and heat. And this is like the gate theory. So it's cold, heat, light pressure, scratching, all go to the brain faster than the pain message. So we're trying to stretch while we have a distraction. Great. So let's take a look at our masseter muscle. Okay. So let's do that. So we're going to open and close the mouth. Okay. So let's go ahead and why don't you go ahead and put 2 knuckles in. Okay. Good. And remember where it refers to the eyebrow. Okay. And then also refers to the upper and lower teeth. Right? Yeah. I think we have it over here somewhere. So like right here. Where is it? It's It's right here somewhere. Any rate, it's over here someplace. Any rate, if it's over there, if it's not here. Okay, let's go ahead. I'm gonna do that while we're gonna go like this, and it goes up to the eyebrow. Okay, so we're gonna go protect your eye again. So we're gonna go spray over it. We're gonna go over the trigger point, then over where it refers. Okay, over the trigger point, and then over where it refers. Okay, where else does it refer? Into the teeth and into the ear. Okay, so open. And we're gonna go over, just over this way, and into the teeth, and then over to the ear. Okay, and let's warm it up again. Okay, we're gonna go ahead and warm that up. Great. And open, and close, and open, and close. Good. And open. If I open and close it, they could encourage you, see. Okay, let's go ahead on the other side. How does it feel after we did the spray? Sometimes we call it the magic juice. So what do you think?
It's good.
Okay, so far so good. And I'm just going to encourage you to sit up a little straighter here. Okay. All right, so here we go. So we're going to go ahead. So here's the masseter muscle right here. And we're going to go ahead and spray over the trigger points, and then over the referral area. Okay? So here we go. So I'm going to cover here so that we don't bother your eye. So open. Okay, you could put your fingers in if you like. You could just open if you don't have to put the fingers in if you want. So here we go. So this lower section right here goes all the way up to the eyebrow. Okay? Then here and into the teeth. And then into the ear. Okay, so here we're going to put this on afterwards. And then let's also do the supra and infrahyoids. Oh, that's going to be great. Let's try that. And the longus coli and the longus capitis. Sounds good? Okay, great. You probably don't know which ones those are.
It sounds good.
Okay. For those of you that know. Okay, so I'm going to encourage the little bit. So we'll have to get we'll have to come to when we're doing the pec one.
Okay.
Get the pecs to loosen up a little bit and the abdominals. So I think one of the things could be the abdominals are pulling you and the pecs. Okay, so let's take a look at these hyoids. So we're going to go over the muscle and then over the place where it refers. So this goes, so here's the muscles right here, but where does it refer? Into the eye, okay, and into the ear, and these, and sometimes into the back of the neck there. Okay, so we're going to take a look, and so if you go ahead, let's have your chin up in a couple different positions. Okay, good. Okay, so when you have it closer, it's not as cold, but if you have it more of a distance, it's colder. Okay, so warm it up. So
okay.
Warm it up after we cooled it. So we're warming it up again. Okay, so just give you an idea. Okay, I'm going to change your position of your posture again. So we're going to put you like here. Okay. See if we can get you to do that. All right. Okay, so we're going to go up with your chin. Okay, here we go. So this goes, so we're going to go from, there we go. How's that feel?
Cool.
Cold. Okay, a little bit, change the little position, chin a little bit more to the side. There, good. And then up to the face. And then up to the face. She's wincing, so I'm not going to go any higher. Towards the face. Okay, over here. Oh yeah, feel the tightness there. Up there. And a little bit on there. Okay, what did you think? Let's warm it up. And then on your eye there. Okay.
And since we're treating seated, we're using the wedge?
I am.
You are.
Yeah, so on a soft surface, she evened out, but when I put her on a hard surface, she definitely was uneven, so I just put her on there for the timing. Yeah. Okay, so let's think about your opening and closing, and let's tell me how everything's feeling. So to go ahead and open. Oh, that's nice. I'm so relaxed looking. They're very nice. Okay, so let's go ahead and open all the way. And close and open. Good. And open. Great. And open. Oh, okay. So when you get to a spot and all of a sudden it opens more, that's the spot that was not allowing the opening. Okay. So you go to different spots. Go ahead and open, so you can feel what their contribution is. Good. Feel that one. That one's contribution is starting to be. They're starting to contribute right now. Okay. And open. Good. And open. Great. And open. Nice. Nice. So it looked really good. Let's see if we hear anything. Okay, let's go ahead and open. Wow, perfect. That's great. That's great. So that's going to help with pain in the eye. Everything that we just looked at. Also, the other muscles that we didn't treat today, that we did treat last week: suboccipitals, the occipitalis, the trapezius, and the temporalis, and we treated those. Last 2 weeks. So what do you think? Do you think you might be able to do it yourself?
I'll try.
Okay, and how frequently do you think you might want to do it?
Should it be done every day?
Yes, every day is good. Do you think you might do it before you went to bed? That might be a good time.
Would it be effective if it's not every day?
Still could be. What if you did it 3 times a week? It still could be effective. Yeah, so it could work. It could definitely work. But I was thinking to help you with the clinching. Maybe that might be an idea, yeah. Since the reason is because you said that it's worse when you wake up in the morning. So I was thinking, what if we treated you that night, and let's see if it isn't worse when you wake up in the morning. Okay.
Yeah.
All right. So that's a good way to look at it. Okay. So the one thing that we did find is that at least right now, if you're sitting a lot especially on a very hard surface, it might be good to put a 1/2 inch underneath the right side. Yeah. At least we'll recheck you again down the road. Well, thanks for being our model.
Yay!
And you're coming back. Oh no, you're not coming back next week. I was hoping you were coming back next week. I forgot you're not. Yeah. So we'll have another model next week, but maybe you'll come back another time.
Thanks, Sharon.
All right. Sharon, would you just review just the exact spray and stretch technique and just
sure.
why it's good again?
Oh, super.
And maybe describe how often you would use it in practice, maybe?
Okay, so the different really great ways to use it. Okay, so would you like to be my model still?
Sure.
Okay, good. All right, so the idea is that you're trying to get the muscles to lengthen, get longer. So heat on the muscle could allow the muscle to get longer, or cold, or pressing on it while you're moving it or stretching it, or light pressure, scratching, so a variety of different things. But one way that we could determine, suppose you had ear pain. We want to figure which muscle is causing it. Okay, so let's try it again. Let's go ahead and sit down again. Sit down. Okay. Suppose we could use it to. So one way to use it is to diagnose if you're a physician, or to evaluate if you're a therapist. So you could go ahead and do the stretch. So go ahead. Let's do the masseter again. So open. Okay. So what if we went like this on the masseter and went like that? Open. Good. And then we applied the heat. And then we noticed that it took away the pain. Then you know that it's likely that this is the muscle that you want to treat to get rid of that pain. So it could be a quick diagnosis or quick evaluation. It's one way of evaluating. So we used to use it a lot more in the past, and they had discontinued the product for a while, and now it's back. Yay! And so this is one way of using it. Other ways of using it is the person could use it on themselves. So say, for instance, you noticed that your wrist doesn't bend quite enough there. It should have a little bit better bend. So here it should have a little bit like a right angle plus. you're doing some you got a little tension there. So you could notice, so one way of treating it would be, you could notice the restriction, and then you're going to treat it. Somebody else needs to hold her hand. Okay. Okay, good. Okay, so we're going to go over so the trigger point would be here. So it would be for the wrist flexors, extensors, I meant. So here, so we're going to go sort of spraying like this. So this would be a way of treatment. So one way is evaluating. Another way you could use it is actually the treatment. Now sometimes people with fibromyalgia, we couldn't treat them. So this would be using the heat and the cold was the treatment. Okay, so this would be a treatment. And then as you're doing it, you're trying to increase the stretch. So as you're doing the spray, you're trying to increase the stretch. So we did quite a few sweeps. Then after, you're going to put the heat on it. And take the chill off. So why did Travell have us do it this way, of using the cold and then the heat? Because cold tightens up muscles, but it's still good for if you put the heat on after. It doesn't over chill it, so it doesn't get all cold. So we're sending a message to the brain faster than the pain message. So here now you're getting closer to passing the test. So it could be a nice treatment for some people if you don't want to do the pressing in. Okay, so I'm gonna warm it up a little more. I cold it up. We made it too cold. Okay, so we're gonna go ahead and put a little heat on it there. So we're heating and stretching and cold. We're using the cold and stretch, and then heat and stretch after. Yeah. So we just got 1 more minute. Oh yes. So today we have a song that we're going to play at the end today. So we're going to play it for us. Camille wrote it.
Sharon and Justin from Pain Free, who want you to remain free. We will assess and use heat, then compress and repeat. When our trigger point is there, we'll teach you how to do self-care. This will keep you at your peak. So see you back again next week.
Thank you for all your work, Bodyworkers. That's for you. See you guys.